Welcome to Expert Talk, and today we have very special guest who is highly knowledgeable, extremely talented and very innovative, Dr. Bhagrishi A Pawar. She is currently associated with Sir H. N. Reliance Foundation Hospital and Research Center, Mumbai. She is also associated with various multi-specialty hospitals and dental clinics in and around Mumbai. Now, briefing you about her journey of becoming a specialist pediatric dentist, she has completed her undergraduation from the Rajiv Gandhi University of Health Sciences, Karnataka, and her post-graduation in the specialty of Pediatric and Preventive Dentistry from the Dr. Patil University Pune. And to add to this, there are numerous achievements, like she has been invited as a guest speaker at various continuing education programs both nationally and internationally. And she has published numerous scientific research papers in various national as well as international journals. She has also written a textbook entitled Aversions in Primary Teeth that has been published by a German publisher under Scholar Press. Now, one of the greatest achievement is she is one of the first pediatric dentists in the world who has designed and clinically implemented 3D printed space maintainers. She has been conferred with the best pediatric dentist for the 3 consecutive years 2018, 19 and 20. And during this COVID-19 pandemic, with her hard work, dedication and her innovative mind, she has invented one of the greatest inventions, that is bee shields, which has brought cheers to babies and kids all over India. So today on our expert talk, Dr. Bhaggyashri will enlighten us on the 3D printed space maintainers as well as her inventions of bee shields. So let's welcome our expert talk. Over to you, Dr. Bhaggyashri.
Thank you so much. Thank you so much for such a warm introduction. One second, I'll just start sharing my presentation and then we are good to start. Am I visible, audible, everything, doctor?
Yes, doctor, you are loud and clear. Please proceed.
So, hi everyone, I'm Dr. Bhagrishi Pawar, and I would like to thank Dr. Prabha for giving me this opportunity to talk on my journey in this 3D printing world. So, I strongly believe that success seems to be possible largely for the people who are hanging on after others have let go. So, again, I'm practicing exclusive pediatric dentistry at Sir H. N. Reliance Foundation Hospital, Mumbai. Science and technology has revolutionized the fate of mankind in numerous ways. Collaborating the knowledge of science and engineering with medicine has opened new doors for innovative healthcare. 3D printing is the ideal solution that addresses individualization in healthcare. This picture is way back in 2012 when I was doing my post-graduation at Dr. Patil Dental College and Hospital, Pimpri, Pune. And we were very famous among our batch because we were the Mahila Mandal batch of 6 girls pursuing pediatric dentistry with our teachers then. So I always wanted to fabricate and deliver a space maintainer in a very short duration of time because I get a lot of NRI patients in my practice who are here for a short stay in Mumbai and would like to finish their work, dental work, in a very stipulated time. So which was getting very difficult for me to coordinate and get things organized for fabricating the conventional space maintainer, keeping in mind the human error, which hampers the fit of the space maintainer. And that's when I met Mr. Shibu, who gave me an insight about 3D printing. And that's when I realized, that victory is always possible for the person who refuses to stop. I learned a lot from this picture. This picture is from the famous Big Ben watch, which is in London. One can learn a lot from this image. So basically, when this watch stops working, the workers have to climb on top and change the time and fix the clock that way, So what I learned from this is that, I need to change the time myself. There's no one who's going to come and change my time. I am responsible. I have to change the time myself. And the next person I met was Dr. Dinesh Jain sir, who's a very renowned oral surgeon, and he's also the managing director of Mumbai's topmost dental lab called Dental Ceramist. Dinesh sir and his technicians really helped me out in understanding the detail of 3D printing. Sir also gave me an assurance that that you're walking on the right path, and he made sure that all my queries and fabrication was a smooth process. And here's a slide from my PhD presentation after talking to sir, after getting that assurance that you're on the right path. I thought I should pursue my PhD in 3D printing, especially in pediatric dentistry. But unfortunately, I wasn't selected, or my topic wasn't selected, because the institute didn't find my PhD topic suitable that time, because 3D printing in pediatric dentistry is something which was unheard and untouched topic in 2017. But then, believe you can, and you'll be halfway there. Because if you want to do something new, you need to stop doing something old. So that's when what I did is I took an ideal mixed dentition cast, poured it in a standard die, and for the trial design of 3D printed space maintainer by digital screening and printing, the cast was scanned using the 3D digital scanner, and the band and loop was designed, which is similar to the conventional band and loop space maintainer. And this is the final design that we thought on. If you can see, I cannot show it with the cursor. The first cast, the first space maintainer, which has the cast on with it, there is a small breakage over there, which we thought that we should keep it. But keeping in mind about this space maintainer especially, it is known to be self-cleansing. And with this gap, or with this division of the band over there, self-cleansing wouldn't have been an issue. In fact, we would have caused a lot of caries and other food lodgement issues to the baby. So that's when we designed another one, which was a clear photopolymer resin-based space maintainer, as you can see in the slide, in the second picture. The first picture is basically a titanium-based powdered metal material, which was used, which is quite similar to the stainless steel space maintainer that we give to our patient. I was very lucky enough to get another, immediately I got a patient, a 7-year-old patient, as I said, short stay in Mumbai. And the chief complaint was lower left-hand side. The tooth had to be extracted because it was involving the focal area and the proximal caries and everything. So we extracted, and after extraction, a standard single step rubber base impression was made using addition silicone, which was poured into a cast. Now this retrieve cast was sent to the 3D printing lab for scanning and printing the metal based space maintainer by the technique which I just spoke earlier. The printed space maintainer was tried in the patient's oral cavity, and after confirming its adaptation, it was delivered to the patient. And when the patient walked into me in his next appointment, which was around 6 to 8 months, you can clearly see that the premolar is erupting there. Then we removed the space maintainer. It was then I was thinking that I should make my prototype scientifically evident. And that is when I sat down to write my first article on 3D printed space maintainer. And I'm glad I did that, because it got accepted without any changes in a nationalized PubMed index specialty journal, which we popularly call as GIS-PPD. And that is when I realized that it will work. If you forget the reasons, it won't. It is a moment of pride for me to tell you all that this article has been the highest viewed article of that issue till date. Slowly, my work started getting its recognition. Students started contacting me with their queries. This postgraduate student actually came down to Mumbai to get her 3D printed space maintainer. As you can see, she fabricated both a conventional and the 3D printed space maintainer in the same patient, and the testimonial is speaking for itself. Failure is a part of innovation, In fact, it's the most important part. So I thought I should take a step ahead, and I fabricated a tooth colored space maintainer, basically to improve patient acceptance towards the treatment. But unfortunately, I failed at it. The material could not sustain the occlusal forces, and that's why we couldn't deliver this to the patient. But I didn't give up, neither my team at the lab gave up. I was informed that they have come across a very strong biocompatible material. And within no time, we fabricated a strong space maintainer, which my technicians used to jokingly call it as. And then the unprecedented COVID-19 lockdown was declared. And yet again, I could not deliver my tooth-colored space maintainer. This is a very famous photo that I've taken from this series called Sacred Games, where, Gaitunde says, "Kabhi kabhi lagta hai ki apun hi khatarnak hai." So, this is what the corona virus got along with it. Like, this is something which has impacted all the human being across the world very badly. And then clear skies, blue clear skies, clean air. Can you see the picture on the left, which is from Jan 1st to 24th March 2020, and picture second is 25th March to 20th April. Can you see the difference? I mean, while animals were taking stroll on the roads, in the midst of global gloom over coronavirus pandemic, there was a silver lining. Mother Earth seems to be rejuvenating itself. The wounds inflicted by relentless human activity appeared to be healing. From cleaner air to liberated wildlife, the corona lockdown came across the world like a positive impact on the environment. But somewhere down the line, to be very honest, I was very apprehensive about donning the PPE look, because I knew that the entire look will make my pedo patients anxious. I wanted to spread smiles across my patients, wanted to make them feel comfortable when they come and visit me in these unprecedented times. And that's when I realized that, innovation is not about market timing. It's about creating and fulfilling something that is unmet. I must take this opportunity to show everyone that pediatric dentists all across the world have really gone and taken that step ahead and dressed up like, Superman or a Peppa, kind of a pink entire look, just to make their kids happy. There were some really cheerful face shields too. There's Wonder Woman, there are these smiley masks, and that's my very own friend, Dr. Eyal Simki, who's known as a magician pediatric dentist, very popularly known as. And when we were speaking, he told me, what, you have to see what I have done when we were talking about my B-Shield journey with him. So this is the picture. He sent it across to me. And that's how B-Shield was launched, by using one of the most promising technology, 3D printing. I launched it with the most popular cartoon characters amongst children. We also took a step ahead. We designed clinic logos. We designed some customized name tags. And with great pride, I would like to tell you all that the cartoon characters, the name tags, the logos are made using biodegradable material. Because we had done enough damage to Mother Earth. Me and my entire team, we did a lot of brainstorming as to what kind of material has to be used, because now we should get into sustainable lifestyles, isn't it? The other USP about this product is that these characters, these logos or these name tags can be assembled into any face shields. So this is kind of a universal product which can be fitted into or assembled into any face shields. Children see magic because they look for it. A lot of my friends, a lot of family members, and a lot of doctors, when they came across these shields, and during the lockdown, the kids were really insisting, we need to go down at least for a walk, for a stroll, or for just a half an hour playtime. And this is how they were introduced to safety. And I must say that the kids were really happy. donning this face shield, And less than a week, B shield started trending on all the leading newspapers across. The deepest craving for human nature is the need to be appreciated, isn't it? A very renowned pediatric dentist appreciated my small inventiveness in South Asian Association of Pediatric Dentists, which was appreciated by many pedodontists in Asia. On the right, Mr. Manav Maglani is a very famous Bollywood photographer who wrote praising about my work and wanted to feature my work, which was appreciated by many people again. Dentists as well as the doctors from the medical field also loved this idea because as you can see, it is a bit difficult to recognize each other in those PPE look. So it became really easy for them to talk to each other, recognize each other, basically just identify each other. So I'm glad we all could, me and my team could happily deliver happy smiles across India. So this is B Shield's journey in COVID times till the month of June. We are still to make, we've got amazing response and we are still to make a new video which is in the pipeline. And these are the kind of feedbacks that keep coming in, and it gives me so much of motivation, so much of encouragement that comes from my peers, my colleagues, doctors from other fraternity. I mean, it's amazing to get so much of love. This photograph is shot by my husband, wherein I was gazing at this beautiful sea. And it reminds me of this famous quote by Nelson Mandela, and which is very close to my heart because in my journey of 3D printing, I never lost anything. I only learned and I won a lot of smiles. Thank you. And these are my contact details. If you have any queries, if you have any questions, if you have any doubts regarding 3D printing or otherwise, you are more than welcome to write into me and I'll be happy to answer them. Thank you.
Thank you so much, Doctor, for your wonderful presentation and enlightening us on your wonderful inventions that you had given us and will definitely reduce the anxiety when we are dealing with children. So this was a really great presentation and really a very useful presentation for all of us during this COVID-19 pandemic. Thank you so much. Doctor, there are a few questions from the doctors from different specialty who want to ask regarding the B shields. So let us first discuss those questions and get the answers directly from you before closing the session.
Sure.
Most easy way.
Sure, you can just ask me your questions. I'll be more than happy to answer them.
Most of the things were like regarding their sizes. Are there different sizes, or they are compatible to every head size if they wish to use it?
See, so basically these cartoon characters, they get assembled into your face shield. So these are standard sizes. Basically, and the face shield that I am providing with that, it has an elastic band with holes in it. So basically, you need to adjust the holes accordingly. You know how you adjust your cap? It's a similar mechanism.
Okay, doctor. And doctor, there is one question from Dr. Albert. He is a PG student. He asks about what are the cartoon characters available as an option? Are they limited, or there are many cartoon characters?
For now, we have manufactured 8 cartoon characters, 8 which are very popular, like Peppa, Doraemon, Unicorn, Minion, Tom and Jerry's Jerry. We have reindeer horns. We have Avengers. Yeah, that's about it. Also,
okay. That means we have all the cartoon characters that are mostly
In fact, just last week I had a pediatric dentist from Gujarat contacting me because he's a big fan of Harry Potter, and we are in designing phase of Harry Potter as well. So hopefully we should have Harry Potter also on our list very soon.
Great, doctor. Great. There is also one more question from Dr. Hina Jain, Specialist Dental Surgeon, Udaipur. She has asked that what material is used, that you had already told us, and also is this face shield autoclavable?
So this is not the face shield is not autoclavable. Neither the characters are autoclavable, but you can use a disinfectant on them and clean them. In fact, the cartoon characters you can also clean it with your hypo or any disinfectant solution that you're using.
Can we sanitize them like?
Yeah.
Okay. And there is one more question by Dr. Smriti, General Dentist, Noida. She has asked that, hello ma'am, please tell about its usability, and I love this thing. What are the cartoon characters? Okay, you have answered this. Usability, she is asking its usability. So that you had already told us that we can, every physician or the doctors who are practicing or dealing with the children, they will definitely use it.
Yeah.
Our question was, few questions are regarding the price details. Doctor, can you give us a fair idea about the price?
Yeah. So the thing is, with the face shield and 8 characters, it will cost you around 900 rupees. And the delivery charges is to be given by the customer's side or the doctor's side. And if you want without the face shield, it will cost you around 800 rupees. And again, the delivery charges is to be charged, given by the customer.
Okay, doctor. And doctor, there is one more question from a pediatrician in Ghaziabad, Dr. Anurag. He said, congratulations for the great inventions, doctor. Is it reusable?
Yeah, it is reusable. It is reusable.
Great, doctor. And there is a question from Kaushal Joshi. He is a pediatric passed out, just postgraduate, and he is asking that what is the durability of it? Means how much time we can use the same face shield again and again? Is it
the face shield? The face shield maybe after a continuous use, you need to just discard it after 5 to 7 uses, and change the visor of it. The plastic sheet, which is called as a visor, you need to change that.
Okay. So then there are some price and some repeated questions and a few more. Thank you so much, doctor, for your valuable time and answering those questions. Thank you so much, doctor.
Absolute pleasure. Thank you so much for inviting me. Thank you.
Thank you.